regular agenda for ASE. Dr. Kerr is here, our Amador County Public Health Officer, going to have a talk on the coronavirus, COVID-19, myths and facts surrounding the illness. Welcome.
Good morning.
Good morning,
Dr. Kerr.
I appreciate the opportunity, Chairman and Supervisors, to come before you to talk about the COVID-19 novel coronavirus and the situation here in Amador County. Just as a little background, the picture that you see on the left is a representation of what this viral particle looks like under a high magnification electron microscope. And the reason it's called a coronavirus is because those little protrusions that stick off the outside of the virus look like crowns. So that's how it got its name. It's one of a family of viruses that have been circulating for many, many years. In fact, we have several usual coronaviruses that cause illnesses like the common cold. And coronaviruses circulate in animals. And the thought and the theory is that every once in a while, one of those that circulates in the animal population makes the jump into the human population as it acquires, mutates, and takes on new characteristics. And that's the theory behind how this new novel coronavirus got started circulating in the in the human population worldwide. As of this morning, I want to reassure you and our public that there are no confirmed cases of the disease that has been, thank you, Chuck, officially named COVID-19. There are no cases in Amador County as of this morning. That being said, the testing capacity is increasing. And in fact, yesterday, several individuals presented to doctors who felt that testing for the possibility of this virus was indicated. And so we have several individuals with pending tests that were collected yesterday, and then we're awaiting results on those. As you have probably heard in the news, there has been spread of this virus in Northern California. And Amador County residents travel in and out of the county every day for things like work or shopping or even receiving medical care. So it's really only a matter of time before we will see cases in Amador County, and we all need to be prepared for that possibility. And actually that eventuality is probably a better way to put it. Going to the next slide, I'd like to, I guess I get to do that. Let me see if I can figure this out. It worked.
You got it.
And then the pointer, got it.
Quick question.
Yes.
There's been a little rumor going around that a student over in Union High School or something in El Dorado had any.
I have not heard that rumor, and I can't verify or refute that.
Okay, thanks.
The reason was called a novel virus is because it's new. It's one that has not been seen in the human population before. And the reason we're concerned about novel viruses is because the blue people on this graph represent people who are healthy, but they don't have any immunity to the disease. And immunity to a disease can come in one of two ways. It can either come from having had the disease and your immune system fought it off and recovered from it, and now if you get exposed to it again, you're not likely to get it again. Immunity can also come from vaccination, but we don't have a vaccine for this virus yet. It's probably not going to come for at least a year, maybe a little longer, by the time it goes through the development process and the testing to make sure it's safe and effective. So what happens when there's no immunity is that as the contagious disease spreads, lots of people get it, they get sick, and they are contagious to others. So as a disease outbreak progresses, more and more people will have immunity, and the rate of spread gets slower. And then, as happens with something like measles as an example, most of the population is immunized, so even if you have a few sick people in the population, it's less likely to spread to the whole population. That's the concept of herd or community immunity. I think that's it for this slide, unless there's questions about that concept. So how severe is the COVID-19? This iceberg illustrates that in the entire population, what we've been seeing so far, the people that have gotten the tests so far are generally in this upper pyramid. And now we may start to see more people in this category who have non-severe disease but get tested, they're not severe enough to be in the hospital, they may be isolated at home, we'll see more positive cases from that group of people. And then there are likely a group of people that never really show symptoms to the point where they would seek medical attention, and they're basically flying under the radar. The statistics from the countries that have been dealing with this so far show us that for novel coronavirus, the split is about 15% up here and 80 to 85%. So this shape of this pyramid is kind of an accurate visual representation. Another thing to know about what we've learned so far in this disease is that this top piece, the green and red points, tend to be in older individuals who have underlying medical conditions. They're the people that get the sickest and are most likely to have fatal illness from this disease. The 80 to 85% tends to skew towards the younger age groups, and in particular, this seems to be sparing the pediatric population. Another thing I just want to mention again is that as testing availability expands and the criteria for who should have a test determined by doctors gets wider, we will see more of the non-severe cases and the case counts overall will go up. It also means, as I click to the next slide, that the relative rate of death per case will fall as we see more confirmed milder cases. So this chart helps us compare where the best estimates now are, where this chart is still calling it the Wuhan coronavirus. It's again been named COVID-19, where it falls in relation to some other contagious respiratory illnesses. For example, from a contagiousness standpoint, measles is way over here. 15 people on average get infected who don't have immunity from every person who has measles, because those droplets are so tiny that when they get coughed into the air, they can linger in a room for an hour and be contagious. That's one of the reasons that we so strongly encourage the public to protect themselves from measles by being vaccinated if they don't already have immunity. The common cold and the seasonal flu are down in this area. Polio, Spanish flu, again, so we're looking at the contagiousness per individual about that range. How lethal is it? How deadly is it? You can see that Ebola is way up here and Spanish flu is here. SARS, we think, is falling somewhere in this range between about where the seasonal flu is and maybe up to 3%
But
based on the data.
that's also a logarithmic scale, so it's
Yes.
a bit misleading. It's not just linear.
Right, so it goes from 0.1 to 1 to 2 to 5 to 10. So thank you, Supervisor X, for pointing that out for those who are watching online and can't see the scale. This is to give you an idea of what we've been doing up to this point. From a public health response as the lead agency in this county responding to this virus. It was basically New Year's Eve when the online news story broke about this novel virus causing pneumonia in China, in Wuhan. In January, along with the federal, state, and world officials, we all activated our public health emergency response and started doing several things. One of those things is keeping ourselves educated, attending webinars, teleconferences, reading all the literature that's coming out, and really attempting to be the local subject matter expert on this condition, and also making connections with people who can answer the questions that we're not prepared to answer. So that's one of the things we started doing in January, and that continues to this day. We activated our internal DOC, which in emergency preparedness is an acronym for Department Operations Center, and started engaging with our external community partners during the month of January to do things like take inventory of supplies, refresh and review their emergency preparedness plans, and continue to actively monitor the situation. Now, one of the things that became a item of concern for shortage very early on are the protective respiratory masks. And the MOHOC function, which you might be familiar with, stands for Medical Health Operations Area Coordinator in the emergency preparedness and management structure. I actually am vested with that role in this county, and we share the responsibilities with our Mountain Valley EMS agency partners. And they really help us with the first responder piece of that puzzle, and also things like hospital bed availability. And then some of the supply functions are really under the purview of public health emergency preparedness. Starting in February, the weekend between January and February, the 31st of January up till the 1st and 2nd of February. Sorry, I almost touched my face there and I caught myself. We'll talk about that one later. I don't want to become an internet meme like one of my colleagues did. We had a couple things happen. There was a presidential declaration and travel restrictions into the United States from areas where spread was happening, particularly Wuhan City and mainland China. Those were instituted, and a returning traveler monitoring program was instituted at the federal level. The state of California has received a significant number of those returning travelers. At this, we crossed the 10,000 returning travelers monitoring threshold just this past weekend. And that has involved 49 jurisdictions in California, including Amador County. So we have been actively monitoring returning travelers, those who were screened at one of the airports and found to be asymptomatic when they returned, told to go home, stay home, be in contact with public health, and monitor themselves for symptoms. And we have been doing that with people under home quarantine and then releasing them from quarantine if they remain without symptoms at the end of their monitoring period. So that has all been going on already.
Question on that.
Yes.
They're telling people go home and quarantine themselves, but wouldn't they be carriers at that point already?
Not necessarily. There is a incubation period of maybe up to 5 days for the beginning, and as long as 12 to 14 days. And so when you use the term carrier, Supervisor Neto, you're talking about someone who is able to transmit to others.
Right.
Having been exposed, if your immune system's going to fight it off and you never develop symptoms, you may never become a carrier.
Okay.
Okay?
Following up on that, the virus can live on surfaces for how long then?
Again, it's not quite known how long. There's theories of, a day or two up to maybe as long as 7 days. I don't think it's entirely figured out yet, but we'll talk a little bit more detail about cleaning and prevention for surfaces in a few minutes. So basically in January, primarily our emergency preparedness function was activated. We really layered in an active way with the returning traveler monitoring, our clinical staff also being involved starting in February. And then now in March, a couple things have happened during this first week of March. Very active situation. Of course, cases have occurred in the United States. Community transmission has occurred in the United States, including in Northern California. Several counties in California have declared a state of emergency in response to this. Santa Clara County so far having been the most heavily impacted and with their emergency operations center running 24/7. The governor declared a state of emergency for the entire state last week, Wednesday. And what does that mean? Does that mean we should all panic? Absolutely not. What that does is allow us all to be more nimble in our response. It allows us to make exceptions to regulations when it's feasible and safe to do so. And a very concrete example of that is hospitals are now allowed to deploy their outside isolation tents outside of their emergency rooms to bring patients in, assess them outside of the physical hospital setting, and keep people safe. And as a matter of fact, Sutter Amador was drilling on setting theirs up yesterday. And they may even they have to go up to their state licensing agency to report that they're going to do it and how they're going to do it, and then the state licensing agency gives authorization for them to do so, and then they can start utilizing that. measure.
I guess I had heard on the news today, and maybe it was in Italy, they're doing mobile testing, so they're sending people out rather than have them come to the emergency room for
That is happening in England.
right.
There have been some mobile testing, I should say drive-through testing
Yeah, maybe that's the
in
term they
the
use.
Seattle Kings County area that's been heavily impacted.
Yeah.
And I even read a news story yesterday that the Bill Gates Foundation is working on a self-swab program where you self-swab and drop off or mail in for the possibility. That's not ready for prime time yet, but those sorts of thoughts are happening.
Is that something that's in the plans for California or in
It
general?
possibly could be.
Yeah.
One of the disadvantages here is we don't have the kind of uniformity to our healthcare delivery system that, say, the United Kingdom does. Because they have a national health system, they're able to redeploy those resources wherever they want to and create those kind of structures. We're working through, a group of people who work together but don't have the administrative structure to be that nimble.
Well, it's good that the hospital is setting up something outside, because I would imagine that would be the place that people would go if they think they might have it and they panic and want to go to the hospital.
Well,
Potentially affect
hopefully the panic would lead to a phone call before anybody goes anywhere.
I hope so.
Oh, along with that, I do want to mention that our emergency first responders have been working under enhanced screening dispatch protocols since mid-January to screen for travel history, risk factors, and so that those people who are at the scene getting ready to transport someone can be alerted to the fact that this person may be at increased risk and put on the appropriate gear to minimize their risk of getting contaminated by an infective individual.
Under your containment strategy, what do you say about those individuals? I think Solano County and another county had one where there was no known transmission.
Right, and the community spread, which is what that is, when we can't link it to a known case, is something that we try to minimize, but we have no misconception that we're going to be able to do 100% of the time. Partly because of these low symptomatic possibilities where people haven't even sought care, they haven't even contacted anyone to say, I've been somewhere risky. It's the kind of thing where our goal is to flatten the curve, and I wish I had put a slide in here about epidemiology. I'm going to go ahead and click to the next one. Because nobody in the country, nobody in the world has preformed immunity to this virus, the risk of a lot of people getting this illness very quickly is a very steep curve. And if that happens, it would entirely overwhelm our healthcare system in the world's ability to respond to it. If we can make that curve lower and slower, it's possible that ultimately the same number of people in the world will get infected and recover over time. But if it's a slower rate, and that's where the containment strategy comes in, it will be less likely to overwhelm our healthcare system and our ability to respond to it.
So what you're kind of saying is it's expected that it will probably run its course, just a matter of it's a sharp peak or a flatter line?
Yes. The other possibility is if the community immunity or herd immunity in any given community of people gets to the point where it's not as easily transmitted from person to person to person, then you'll start to see the case rates start falling. And that has started happening in China and in South Korea. Both of them had an initial peak of cases and are now on a downslope. It doesn't mean they're completely gone, but fewer new cases per day are showing up.
Is that because it's basically went through the population, the ones that get full-blown infections have got it, and the ones that get immunity have fought it off? And
that's part of it, and part of it is the better containment strategies of isolation, quarantine, and the hygiene and social distancing measures that we'll talk about in a little while. So this slide shows kind of the basic functions that public health has in our toolkit to respond to an outbreak scenario. There's a few things we don't have in our toolkit yet. One of them is a vaccine. We also don't have medical countermeasures, which means like a pharmaceutical medication that is an antiviral that is effective against this virus. There are some in clinical trials. We had some existing antivirals that they're trying in research settings to see if they're effective against the virus being deadly, and also in risk populations to see if those people who've been exposed and take that antiviral never actually develop the disease. So those trials are happening. Once those come, that gives us more tools in our toolkit. But for now, what we have is surveillance, which is testing. And as the testing capability increases, we'll have better surveillance data. Case identification on both a test result and symptomatic measures, and contact tracing. And I want to go through with you a little bit what that means. But first, let me define a couple of terms that get thrown around a lot and confused a lot. Quarantine and isolation. Quarantine means that someone has been exposed to a contagious person and they need to be separated from the population so that they can monitor themselves to make sure that they're not going to become symptomatic and spread it to others. Isolation means someone is sick and needs to be separated from the population and special precautions taken among their caregivers because they are considered contagious and able to spread the disease to others. So I wanted to go into contact tracing a little bit more in detail because this concept, as cases show up in our community, will be a large part of the work of public health. We do this every day for communicable diseases that can be spread from person to person. When we get a report of somebody who has any communicable disease that's of public health concern, we call them up, we find out who they've been in contact with, we find out where they've been, and depending on the disease, we take more or fewer actions and recommendations. Sometimes it's as simple as bringing in their contacts and treating them with a dose of antibiotics to prevent them from getting it, or treat it if they already have it and they're asymptomatic and didn't even know they had it. In this case, for COVID-19, since the since the incubation period is considered to be 2 weeks, and we're not completely certain at what point in that incubation period someone may have become infectious, we will go back an entire 2-week period from the time that they had symptoms. And this 2-week period gives us 2 pieces of information. One, where might they have gotten it? That's helping us figure out whether it's related to a foreign exposure or a known case here in the United States, or whether they just picked it up from a surface. And that's where we're concerned about the possibility of community transmission. It also allows us to identify who they may have been in contact with and warn those people to start themselves on quarantine under our public health supervision. So this is a really intensive process if people have been in contact with a lot of others. And basically, this is kind of one of the core functions of what we do. And it looks like somebody may have a question. I'm taking a quizzical look.
I hear some people are very concerned about finding the initial source. Does that even matter at this point?
It's an exercise that the World Health Organization is involved in tracking. And ultimately, usually they find a most likely place where it originated. And when you're talking about a usual source, it's not so much who was patient 0, but where do we think this virus came from? Maybe what animal reservoir, for example. Because what that helps us with in the future is if the next outbreak that comes along. So we'll compare this one to SARS and MERS, which were both on that graph earlier. Those are the 2 most recent, both of them coronaviruses, outbreaks that happened before this one. And so some of what we learned during those 2 is informing our response to this one. And that's why that tracing back to the source concept is important. We talked about containment a little bit. We are now transitioning to mitigation strategies on a global, federal, state, and eventually we will do more mitigation at the local level when cases appear here. So we mentioned the travel monitoring program. You're probably aware of the fact that most commercial airlines had not been flying to and from mainland China since the end of January. And now the focus for mitigation will be on reducing social mixing. So when community spread is identified, we will be providing guidance for social distancing. And the state, all the state health officers and several other state agencies spent time over the weekend reviewing and putting all the best scientific minds to work and developing guidances for what are the thresholds for which actions. And those were published on Saturday evening. And at this point, we provided the school guidance to our schools. They have it, and we're working together with them so that informed decisions can be made when we see activity in the community. For large public gatherings, we've had lots of calls, and I'm really grateful that people are reaching out and looking for information, and now we are going to post this guidance for people who are organizers, event planners of large gatherings, so they can start to take the steps there are steps they can be taking now, and then there will be thresholds where we might have to talk about modifying or possibly even cancellation of certain events, depending on what they are. At this time, as of right now, again, we haven't had a case in this county. We do have to realize that there's activity in neighboring counties in Northern California, and think about what steps our large gatherings of people need to modify in order to keep people safe. Again, we have a county with a majority geriatric population. Older people tend to get sicker, and guidance is coming out. There was a news release at the end of the day yesterday by the Department of Public Health advising older individuals to minimize their travel outside their home. What does that mean? Well, it may mean let's try and make one trip to the store per week instead of 4. Maybe take advantage of some of these order online, have them deliver it to your car services that a couple of our local retailers offer, rather than going in and browsing the shelves. Don't make your shopping trip a social outing anymore. We may have to modify large gatherings of individuals in those at-risk populations, and we will be reaching out to, for example, the Amador Senior Center to talk about safety and potential modifications, so how they can provide their services in a format that doesn't require people to gather. Even in church services, we're talking about don't shake hands anymore to greet each other. Let's use use a verbal greeting or a nod of the head or a wave, or if you bump elbows with people, it's pretty hard to turn around and touch your own face with your elbow. So by minimizing the spread of germs by less physical contact.
People are having to travel right now just to find toilet paper.
That's,
My daughter had to go to like 4 stores yesterday just to find some.
and I did see signs at one of the local supermarkets on the weekend limiting how many bottles of hand sanitizer and cleaning wipes people could get in any one trip. Let's see. I think that's all I needed to talk about on that slide. So at this point, what can every individual do? Number one, don't panic, but I also don't want people to be nonchalant about this. We need to prepare. We need to prepare by planning and by taking precautions. The part of the slide on the right is something that the California Department of Public Health put out last week. You've probably seen this messaging from the Centers for Disease Control. It's consistent with the messages that we've put out and will continue to put out in our public communications. And hand washing is really the number one thing you can do. Why is it effective? Well, this virus has a lipid or a fatty covering on it, and the detergents in simple liquid soap or foam soap even, but liquid soap tends to be the best because you wash the foam off too quickly and you don't have enough rinsing action. You really need to wash for 20 seconds under running water because the detergent breaks up the particles and the water washes them away. As far as cleaning surfaces, if you don't have a known case in your house or your business, you can clean with any standard household cleaning product. For people who are caring for someone in a hospital setting, or even in a business setting, if you have a lot of public traffic, what you want to use after your routine, soap and water cleaning is an EPA labeled disinfectant. There's a lot of cleaning sprays out there. Some of them are vinegar based or essential oil based or that sort of thing, and those may not be effective as disinfectants. There are disinfectants like the Clorox and the Lysol, and even a simple solution of household bleach diluted with about 1.5 tablespoons per quart is effective to kill this virus. You want to spray it down and let it air dry or have it sit for at least 3 minutes before you then wipe the surface with a clean paper towel and throw it away. You don't want to reuse the wiping rag because there's possibility that there could be some residue on the rag. So those are sort of the cleaning procedures that we continue to recommend. And while we're on this slide, I want to talk about masks because we keep getting that question as well. The masks are effective for 2 things. One, when a person is sick and coughing, putting a simple mask on them, not an N95 tight fit face piece, a simple mask captures some of the particles that they would be coughing into the air otherwise. The projection when someone coughs is thought to be between 3 and 6 feet. And so that's kind of the magic distance as how far away you want to stay from somebody who's sick. I'd say 6 feet or further away. For caregivers or healthcare workers who need to be inside that 3 to 6 foot zone, they're the ones who need the N95 respirator masks, very tightly fit around the nose and mouth so that no air leaks in around the sides. The goal is that every bit of air that's coming into through their mask is coming through the mask filter. And then when they breathe out, guess what? It's not going around the sides. They're breathing out into the mask, which means they start rebreathing their own air after a little while. And when that happens, if you've ever had to wear one, it feels like you're at elevation before too long because the oxygen level starts to gradually go down and the carbon dioxide inside your mask that you're breathing starts to go up. It's one of the reasons those masks are not recommended for people with chronic heart and lung disease. So if any of you have ever had to be fit tested for one of those from an occupational standpoint that requires it, those are some of the conditions that screen you out and they say you shouldn't be using one of those masks. You need some sort of alternative like a full hood with a powered air exchange if you really need to be in that environment. That's one of the reasons we don't recommend those high intensity masks, those filter masks for the general population. Also, the simple surgical mask, while it may filter some of the air that's coming in, there's enough leakage on the outside that it gives people a false sense of security if they're wearing it. They may not be as careful. The other thing is when you're wearing one of those, you're more inclined to touch your face to adjust it, and you may contaminate yourself that way. So that's kind of the basics about why the masks recommendations are what they are, which is general public is not advised to wear masks to protect themselves at this time. Okay. Accurate information is absolutely essential. This is the screenshot of the landing page for the CDC website for coronavirus. And you just click on those tabs depending on what you're interested in, and there's lots and lots of information for people who want to go ahead and read through all that. I do get questions regularly about travel, and there's an entire section just dedicated to travel recommendations, for example. Under the community schools and businesses tab are cleaning recommendations and other considerations for preventing the spread and that sort of thing. So this is a great source of information. We have a link to this page from our public health website. The California Department of Public Health has been coming out with specific guidance and keeping that up to date as well. We link that on our website as well. And then we're trying to sort of highlight and post the most meaningful pieces for our community, kind of, even above and beyond those links. I'm happy to take any further questions from you or from our audience at this point.
All right. Any questions from the supervisors?
I guess just worst case scenario, I I guess, trying to contain things as much as possible. But do we have enough? How many hospital beds and ventilators? I mean, we do have an older population here, which is a concern. And, it's much, the older population is much higher here. I guess the death rate has been the highest in that group for a lot of reasons. And I guess they have underlying health issues. Are we prepared enough in that?
So you're speaking, Supervisor Axe, on a local level, or are you thinking
On a
globally as the
local
state of
level,
California?
primarily for Amador, because Amador specifically, we have more seniors by percentage than, say, the Bay Area does.
Yes, that is true, and that's true of most of the rural counties up and down the Sierra Nevada.
Right.
As you know, we have one hospital in this county. That hospital has some airborne isolation rooms and has trained staff and has some ventilators. Would it be enough for a surge of patients? Not likely. But that's when the mutual aid, the medical health coordination system kicks in. And in fact, we have been doing regular bed polls, not only locally and in the region, but statewide, on a several times a week basis to keep track of what hospitals have availability, what hospitals have staffing capacity. And so it may be that if our local resource is exhausted and someone needs to be hospitalized, that they get transferred to a hospital outside of the county. To be honest with you, that happens on a pretty regular basis anyway, because our hospital capabilities for things like a cardiac emergency, we have capability of stabilizing, but when someone needs interventional treatment for that, they always travel outside the county. So that sort of shared resource will continue to happen.
How likely would it be, like, schools would have to be closed and things like that?
It really depends on the nature of the spread in the community and whether or not we meet the thresholds that are set out in the guidance for that. And we, as I said, are in regular communication with our school officials about that possibility.
What are the thresholds?
You know, I can pull up the document. I don't have them in my notes in front of me, but it has to do with the number of cases of community spread and where they have occurred.
Okay.
Yes.
Right now, it's the elderly and those that might be sick for other reasons that are the most susceptible. Can you talk about kids a little bit more? It seems naturally I would think their defense systems are not built up, but that could be all wet too. So.
Well, I haven't seen a good explanation, and I think it's still being researched why it's sparing kids. One of the theories is that kids are, exposed to new germs all the time, including a lot of the common cold type coronaviruses. And so they may have a more primed immune system ready to respond to this. It's also true, we know from vaccinology, that young immune systems respond more robustly to a new antigen. And so that's why we immunize kids when they're young. And there are some vaccines that over time become less and less likely to mount a great immune response over time. So it may be that it's just that their immune system's more in better shape, more conditioned, and able to respond more quickly. I don't have the absolute answer, but I can say with confidence that this severe disease, at least, has not been seen in any significant degree in the pediatric population. Of course, there's a case here and there of a severe pediatric illness, but not what we would expect from as widespread as this has been. I didn't mention the worldwide count past the 100,000 cases threshold over the weekend as well.
Right. Any other supervisors? If not, any public comment on this issue? Oh,
Quick question.
Sorry.
Dr. Kerr, maybe if you could repeat the best approach somebody could take, they think they may have it.
Oh, yes, thank you.
What number to call?
So they should first make contact with their primary care physician, who can give them guidance, or through some people's insurance, certain providers like Kaiser, for example, have a nurse advice line. That would be the first place to call to get the best information. I think we have actually published, and there's underneath the community schools and businesses, there's tabs with documents, and I thought I had provided some for our packets this morning. Are those available? Okay, what to do if you're sick. Basically, don't just show up somewhere. Please call ahead, because that gives where you're going, whether it's a clinic or a hospital, a chance to prepare and be ready with a mask for you to put on and masks on their healthcare providers before you start interacting.
Okay, thanks.
All right.
And so at that point, would the primary care physician handle that situation, or would they have to contact the health department or anything like that?
It depends on the situation. What the primary care doctor would do at this point is interview the person, find out what their travel history, what their exposure history may have been. Let's not forget that we still have a very active influenza season going on. And over the past couple of weeks, many of the people that have contacted the healthcare system concerned I might have COVID-19 have tested positive for influenza. And then we know the answer to why they're sick, and we can reassure them that it's not the COVID-19. There is more and more the physicians, and this is what happened yesterday in the couple of cases that were tested, have tested those individuals for influenza, and they have not had influenza, so we said it's reasonable to look for COVID-19. There's a list of about 20 other viruses on a viral respiratory panel that we can test for, and we've had some people who've gone through that entire panel that have shown up with other viruses that explain their symptoms. But what we're really looking at this point is what's the potential exposure history and how sick is the person, and then that informs the decision on whether to test for the COVID-19.
There's an advisory right now not to go on cruises, correct? So why isn't the advisory extended to airlines then?
The cruise format allows people to be in very close contact for an extended period of time. And the airlines, and it's a huge number of people. At this point, airline travel has not been shut down other than to and from countries with known ongoing community transmission. You know, I think there's always a risk-benefit analysis to every one of these large decisions that we make, whether it's to cancel an event, to close a school, or to shut down airline travel. Everything has consequences, and we really need to make a decision about how much of our regular life can we continue to go on with by taking proper precautions, and when does that threshold get crossed where we really do need to not do what we had, planned to do ahead of time.
Well, also, I guess on ships, it's hard if you're experiencing serious symptoms to actually get off the ship and be hospitalized.
Yes, that is true as well, where on a plane you could bring the plane down and take someone off to the hospital.
Yeah, I mean, most flights are a few hours, so anyway, that would be the other thing is you have a bad medical condition, being on a ship is not a good place to be.
Right.
Okay. So we're seems like we're prepared, we're ready, and it's probably going to come here, right?
Preparation is a process,
Yeah.
and it's an ongoing process, and we'll continue to work those plans. And when we see cases, we will respond appropriately.
Okay.
All right, we'll entertain a public comment or questions for Dr. Kerr. Please come to the microphone. And state your name for the record, if you would. Oh, I knew that, but there's probably a few who don't.
Well, it was a simple question. Do we have test kits in our county?
Our county does not have a public health lab. When we test, we have the kits to collect tests. We don't have the kits to run tests. So when we collect tests, we have been sending them either to, in the first few weeks, we had to send all the way to Atlanta, to the Centers for Disease Control where testing happened. And then in the last few weeks, the State Department of Public Health has a lab in Richmond, and we've been sending tests there. As of yesterday, Quest Labs and LabCorp are now able to run tests. So for doctors that think testing is indicated, those samples can be sent, and the Quest lab is over in San Juan Capistrano. Their Nichols lab is the lab in Northern California from Quest that's running the tests. So yes, Tests have been collected in Amador County. All of the ones that have come back to this point have been negative. And like I said, we have a couple new ones that were tested yesterday, and we're awaiting those results.
So we have lots of test kits.
What do you consider lots?
Well, there's lots of older people in this county.
To be honest, the test kit that we use for collection is the exact same kit we would use to test for flu. It's the same swab, the same kind of tube with the same chemical in it that gets packaged, bagged, refrigerated, and shipped off to the lab.
I understand. Okay, thank you.
Thank you, Lois. Bill?
Good morning.
Good morning. Bill May. First of all, thank you very much. Very interesting presentation. Recently, I read a statistic that said that in 2019, 38,000 people, more or less, died of the flu. Thus far, maybe 24
Yes.
have died
Yes.
from the coronavirus. It makes you stop and wonder how much we are getting this overblown. And I believe it's being overblown because it's been politicized. You have the Democrats saying, it's all the president and Republicans' fault. And you have the president and the Republicans saying, no, it's your fault. Nobody wants to be the ones that's at fault, so they continue to fight. In the meantime, I don't know how you ever control these crowds. March Madness, the basketball, college basketball season starts next week. The NBA is ongoing. Major League Baseball is ongoing. All of these groups are ongoing, and they play in front of crowds. And there's not much, I mean, you can take precautions, but the fact is, they're playing to crowds. Ironically, both the Republicans and the Democrats have got this whole issue of the elections. There's, I believe, 6 states right now holding elections for president today. And guess what? Those guys are all there, and they all are encouraging crowds to show up, to vote. Now, it's, again, not to minimize, but it seems to me that what we have done is just blown it all out of proportion. This morning I was reading a blurb on the CSAC website. There were 63 items listed, 56 were about the coronavirus, including the fact that some restaurants in San Francisco are now taking the temperature of their patients or their customers before they allow them to come in. It's kind of getting like I say, not to minimize it, but I think we've politicized it and caused this to be a far bigger deal than it should be. Thank you.
Thank you, Bill.
Thank you for your comments, and I'd just like to make one follow-up point. And one of the point I'd like to make is this is scary because it's new, and we don't have vaccine or a countermeasure for it. Influenza absolutely is much more likely. It can be deadly. We do have some things people can do in addition to all the hygiene practices that we talked about, which is a flu vaccine. We also have flu treatment with an antiviral medication. And so I think it gives people a little bit more reassurance, but I think people also need to realize that that's the respiratory illness they should be concerned about on a daily basis as a real risk in this every season this time of the year.
Yeah, I mean, I've gotten my flu vaccine for like 20 years. I haven't gotten the flu since I could remember. It's probably been at least 20 years. And that's the problem. We don't have that protection, especially for the older population in this community. And right now, if we just let things be, it could spread like a chain reaction, and that's exponential growth. And that could overwhelm all of the facilities in our hospitals, and that would, impact the older population. That's the concern.
Yeah. There are times during the flu season when there's particularly high activity that the healthcare system is very stretched already. Fortunately, a lot of the flu cases we've seen in the past few weeks have been able to be treated as an outpatient.
Right.
I saw another hand. Please come to the podium.
My name is Nikki Oneto. I have, it's not the COVID, that's the big problem, but it's taking care of ourselves so that we don't expose other people. That's the risk. You know, we all have a grandparent or an older person. So while it's not a big panic, we still have to be aware that this is a reality, and the percentage is higher for our older friends and family members. And so also with the schooling and stuff, in Galt, they had an incident in the school, and so at what point, I know you kind of touched a little bit on that, but at what point do you tell everyone to stay home from school and do your homework there?
There is specific triggers and guidance, and I don't have them in front of me right
Okay.
now, but I remember enough from the discussions that happened over the weekend and then the guidance that was published is the first thing we're looking at is if there's a confirmed case in a school. And if there's a confirmed case in a school, we would probably recommend closing down that school site for deep cleaning and, you know, sort of quarantine of the potentially exposed others in the school. If there's widespread confirmed cases in several schools, that might trigger an entire district close down. But again, those thresholds are well defined in the guidance, and we are working together with the school officials here in the county to make sure that we're keeping them informed on a daily basis of what's been happening and what continues to happen.
Now, I know you're not the education department, but if somebody felt like, you know, their child is prone to asthma, and they chose to stay home, do you know if there's who you contact about that?
The schools already have in place a self-study program possibility for anticipated absences of longer than a week. And so if that is a concern for any individual, I suggest that that person talk to their school principal about setting up a home study program. That is a possibility already. That's in place.
Okay, yeah. And is there, for the supervisors, being that California's economy is tied to China, do you foresee any problems with the liquid asset, you know, money and things like that, since the economy is so close to China's, having it impact California government, which would then flow down to our counties?
I don't know if it'll impact our government, but it certainly will impact our economy. I mean, I went to buy something at, electronics are a lot harder to get a hold of right now because a lot of them come from China, or at least that's part of the whole supply line. Maybe the parts are made in one country and assembled in another. So, it's, you know, based on what's happening in the markets, we may take a bit of a nosedive for a while.
Well,
Following that, maybe Dr. Kerr, you can comment on this. I was at a meeting last week where our counsel for ACTC said there's been some talk, if it becomes epidemic, of shutting down all public meetings from the state health, Department of State Health.
Which ATCT are you? Is that the Transportation Commission?
Yes.
Okay. Yes. And if that comes down from the state, you know, we would certainly, you know, take a hard look at that here in the county. I think we all need to be planning for that possibility and thinking about doing things like remote meetings. Fortunately, we have a lot better technology that allows us to do things like video conference, and so people can call in remotely. It's not ideal. It's not the same as a face-to-face meeting, but it's a way to get work done without having to be in close physical contact.
Thank you.
so basically, so kind of the word that I heard is that if California loses access to their money because it's not flowing in, that they will actually come to the counties. And so, you know, can they come and take our county's money? I mean, it sounds like far-fetched or anything,
You
but
mean
we
the
know California
state
isn't
government the state government taking?
Yes. I mean, I already know they don't give you everything they're supposed to.
Right.
Okay, but can they come and take what you already have if they feel like they need it?
If
don't
they
see
need
that
to
happening,
appropriate
no.
something, yeah, but I don't think, I wouldn't worry about that. I would worry about our economy going into maybe a recession or having GDP growth of 1% as opposed to 2 or 3. So that's
Yeah, economics would probably be, well, there's probably gonna be some economic disruption.
Yeah.
And like what the Dr. Kerr was saying is a lot of people are going to get it and not even know they had it. I mean, so is it an issue? Yeah. Is it going to be widespread? My guess is probably before it's over with. So I think it's something new and people are kind of, the nations are not sure where they're going really in a way, like Italy's doing a quarantine in northern Italy.
They expanded it to the whole country.
Okay, did they? Okay.
Yes.
And so you look at that and will it succeed? I mean, how do you avoid going out and seeing people? People have to work, people have to get food, people have to do stuff. And you interact and you got something that spreads and that's reality.
Wash your hands, think about all the surfaces that you touch that other people have touched, and keep unwashed hands away from your face. Those are the three most immediate things any individual can do.
And I keep wanting to touch my nose and
It's the second you say that. Absolutely.
All right. Yes, Rich. Thought I saw a hand up over there.
Thank you. Rich Pember. I had a question. Is there the capability to test facilities at like maybe this building or the casino came to mind? People, thousands of people in and out all the time instead of just individuals.
Right.
Is that out there?
At this point, environmental testing has not been deployed, but environmental cleaning, enhanced cleaning recommendations have.
Is that something it's being discussed or do you know?
Thinking about it from a practical public health standpoint, it wouldn't do a whole lot of good to test it because it wouldn't change what we would do. The enhanced cleaning recommendations are what we would do if any given building, we swabbed a surface and it showed up, we would say clean that surface, make it no longer infectious.
Okay.
So we're really more concerned about the population reservoir than we are about the surfaces that surround us.
Sure.
Okay. All right. Well, thank you.
You're welcome.
All right.
Looks like John's just dying to comment down back there. Maybe not.
Anybody else have any comment? Bill, we'll hold on, give everybody a chance first, and then you. No, I don't see any. Come on. Want to make sure everybody gets a chance to speak.
Just quickly, back to the politicalization of it. President Trump, as we know, is into these conspiracy theories. This time he may be right. He is absolutely convinced that social media and the Democrats are trying to tank the economy because the election is coming up in November. And as you'll recall, the Dow dived 2,000 points yesterday. So he may be right on this one.
Thank you, sir. All right, any other public comment? Oh, yes. Good morning.
Rhonda Pope Flores. The gentleman, I just wanted to address his comment about the casino. Actually, Harrah's, have a little bit of insight on that, has a phased approach that they've already incorporated in dealing with cleaning and a schedule to address how they're going to, plan of action, that kind of thing. So that is on our radar, just for the gentleman who asked the question.
All right.
Thank you.
Thank you.
And we have been hearing that over and over from our partner agencies and our Community Preparedness Coalition. They have been receiving the guidance and taking action on the guidance for things like enhanced environmental cleaning.
All right, any other public comment? Seeing none here now, we'll come back. Dr. Kerr, thank you. That was
Thank you, Dr.
quite
Kerr.
the presentation.
Welcome.
Now you probably want to get back to work.
Absolutely. Well, this is part of the work, but I have to get back to a different aspect of it. Thank you.
All right, thank you. Thank you very much. Well done.